The La-Crosse County Health Department says they have a new method to show how La Crosse is doing with COVID-19 spread. Leaders announced yesterday their former risk tool, the coulee-COVID-19-compass, would no longer be used. News 8 Now's Jordan Fremstead tells us why officials thought now was the best time to make the change.
Health officials continue to learn more about COVID-19. Its complicated nature affects every piece of society differently. And La Crosse leaders are now changing their approach to figure out how we are doing as a county as we continue to live during this pandemic. The coulee-COVID-19 compass report is done.
And we would have been in orange or high risk.
La Crosse County officials say the former county COVID-19 risk report served its purpose.
For some, the compass was confusing and wasn't an accurate view of the risk level in our community, while for others, they expected the compass to provide all the answers.
The compass showed how bad the risk for virus spread is in the county. La Crosse County leaders are moving on to a new risk assessment tool. The tool will involve community partners, including healthcare organizations, school districts, and businesses.
The new tool will include 9 metrics, which will cover both healthcare and public health, while providing a more nuanced assessment that will reflect a more accurate snapshot of the current risk to the community.
3 of the 9 factors include daily case rate, daily hospitalization rate, and hospital capacity. La Crosse County Health Director Jen Rumbalski says they are changing their approach with the new information they know.
We have to be flexible, and if something is not the most effective tool or support for our community and we can make it better, then we need to do that.
Since every person, business, and organization is different, they wanted to include more metrics to show the real risk to the community.
We need to get on with living in our community in this virus environment.
Local school districts relied on the compass in order to make decisions about the fall semester, but local health officials say this doesn't really affect their timeline, and they'll still be able to make those decisions based on their new process as we move forward to the fall semester. Reporting outside the La Crosse County Health Department, I'm Jordan Fremstead, News 8 Now.
La Crosse County officials say the reason they did not want to keep pushing the compass report is they didn't want to risk contradicting their new risk assessment going forward. And they say that's why they stopped the report when they did.